You are the Canadian Donation and Transplantation Research Program. You are CDTRP.
The CDTRP is a network of more than 400 clinicians, senior, mid, and early career researchers, trainees, patient, family, and donor partners, and 100 partner organizations. Our network has supported 275 collaborative research projects and has mobilized research into policy change, legislation, commercial products, and improved knowledge for patients, families, and donors. Every year, CDTRP supports between $30 to $40 million in grant applications, something around 60 to 70 individual applications. You are CDTRP. These achievements wouldn't be possible without your hard work.
CDTRP Research Services is a platform that supports principal investigators to develop high-quality research in donation and transplantation. We work hand-in-hand with CDTRP investigators to maximize the effectiveness of research teams through support with funding development, project management, patient, family, and donor partnership, knowledge mobilization, events, and trainee support. Across the 5 research themes, we help teams mobilize new knowledge to ensure patient, family, donors, healthcare systems, partners, and stakeholders equitably benefit from research results.
If you are a basic scientist and would like support with your knowledge mobilization plan, if you are a busy clinician scientist with limited time for research but would like to run a multi-site study, if you are an early career researcher and looking for collaborators to help with your grant applications, if you value patient, family, and donor engagement but are not sure how to find the right patient partners or what role they will have in your project, if you don't have full-time research staff but need support,
we are here to help. Our experienced management team can support you at every stage of your research in donation and transplantation.
Now you are probably thinking, how can I request CDTRP Research Services support? The answer is simple. Go to the CDTRP Research Services Platform website, fill out the form to request support, and we will get in touch with you to discuss your needs. That's it.
We.
No.
Noi.
Nos.
Emis.
Nosotros.
Menk.
Kiano. We. Kiano.
Our CDTRP, and we will drive research advances so that every wish to donate is fulfilled and transplantation becomes a lasting and sustainable cure.
You are CDTRP.
Email us today.
Welcome back, everyone, from your break. And for those of you just joining, thank you for joining the CDTRP's 2024 Patient, Family, and Donor Research Forum. It's now my pleasure to introduce our next speaker, Maureen Smith, for her presentation, A Roadmap to Youth Engagement in Clinical Trials, Lessons from Inform Rare. Maureen Smith's commitment and passion for patient engagement and patient-partnered research stems from a rare disease diagnosis in childhood and frequent flyer status with the healthcare system. She has benefited both from participating in pediatric and adult clinical trials and collaborating with trialists as a patient partner. She co-leads patient engagement for Inform Rare, a rare disease pediatric research network, and is a member of the ACT Consortium's Patient Engagement Committee and Training Committee. Maureen has the privilege of leading the Impact Training Platform's Parent and Youth Mentorship Program, and in June 2023, Maureen was appointed Adjunct Professor at the University of Toronto DallaLana School of Public Health, a recognition of the expertise she has acquired in patient engagement as a person with lived experience. I will pass it off to Maureen now.
Thank you so much, Amy, and thank you so much to your organization for the lovely invitation. I've been looking forward to this for weeks now, and lovely to see that your co-chair, one of the co-chairs for this meeting, is a patient partner. So you're obviously walking the talk. So I'm here today to talk to you a little bit about youth engagement. And I've been asked by Manuel to make it as practical as possible. So I'm going to do that. So I'm coming here on behalf of Inform Rare, where I'm actually a co-principal investigator. And when that was set up years ago, that was quite uncommon for a patient partner to take on that role. And thank you. You're going to be moving the slides for me. So next slide. Thank you so much. So this is just a little bit about our research network and multidisciplinary worker, more than 65 investigators. I'll put their names up at the end, but we focus on 3 pediatric rare diseases. So mucopolysaccharidosis, which took me about 5 years to learn how to pronounce that, phenylketonuria, and spinal muscular atrophy, which from now on I will use those acronyms to describe them. And we are very proud of our patient engagement. So next slide. And this is what it looks like. This is how we engage with about 20 to 25 patient partners at any given time. Myself as co-principal investigator, 6 of our patient partners are co-investigators, and about 15 are youth or parent advisors. For this presentation, I'll focus on the youth advisory group. So more to come very soon about how we set that up. So next slide. So really, our patient engagement strategy was co-designed from the very beginning. At the idea stage, the patient partner is very involved in selecting the outcomes for selecting the research question and the outcomes and the full grant application. And you'll notice here that we only began our youth engagement and our parent advisory group in year 2. So we took a year to set ourselves up and work with our 7 partners that we had, and then we went on to expand. So you don't have to boil the ocean the first couple of months. So next slide. So just very briefly, and you probably know this, some of the benefits to engaging with youth in research. So that increased relevance in the research agenda and a design that drives higher engagement among young people. They often are the ones who make the decisions whether to join the clinical trial or not. Increased recruitment, higher ethical standards, better data collection due to increased trust and rapport with their peers, more insightful data analysis, and of course, a wider and more effective research dissemination and or translation. Next slide. But there are lots of gaps in youth partnered research. So most of the published research doesn't report on the background of the young people who are involved. So it's difficult to conclude how inclusive it really was. The young people are more frequently involved in research design and data collection, and less in the agenda setting and the dissemination and translation of findings. Some young people tend to have some control over decision making in health research, but typically less than adults. And the majority of research involves the most privileged young people and excludes those who are disadvantaged. So those are some of the gaps that we're working on. So at Inform Rare, we use different levels of engagement. Just to be clear, the first two levels on this diagram, we don't consider patient engagement. We consider those people to be participants in the research. So we start at the consult stage, and you can see how we've spread it out there. But we're actually very flexible in that approach. So for the patient registries, for example, I took a step back, and our two patient partners who are CEOs of their patient groups actually were at that lead and support, because they co-designed the registries. And then just recently we've had a youth project collaboration with the University of Toronto, and that was really at the collaborate stage. So the advisors moved up to that stage, and we now have our first youth co-investigator on one of our clinical trials. So we have this kind of set up, what we were thinking of when we first set it up, but I guess the biggest thing is to be flexible, and we've increased our engagement levels. Next slide. So we convened our group in April 2021. So we're starting year 4 now. Their ages are 12 to 18. So take a good look at that, because often when we're talking about youth engagement, we're talking about young adults. So a lot of youth groups use a WHO definition of youth, which would go to age 25, but we're a pediatric group. So we actually go to age 18, and we recruited them through 3 patient groups, and we used Twitter, which was quite popular at that time. And their initial role, as I said, was really to provide advice at these key points during our research projects, but their role has evolved to higher levels of engagement. Okay, next slide. So engagement with youth in clinical trials, I'm going to put up these common concerns, and I'm going to address them a little bit later. So too difficult to explain clinical trials and research methodology, which is completely false. Youth are vulnerable and could be harmed, true. And so we use a trauma-informed approach, which can mitigate that. Caregiver, some people believe that caregiver engagement includes youth perspectives. We don't agree. We think that's false. They each have their own ideas, and their own, what's important to them can be quite different. And finally, that there are ethical implications in engaging with minors. That's very true. And I'll talk a little bit later about some of the special considerations that we've put into place for all of those common concerns. And if you're not convinced about them being swallowed up in the parent advisors, that they would include the youth, well, here's a pretty good example of parents thinking something is just great, and this is the perspective of the youth. So it's kind of interesting. Next slide. Okay, so I'll talk a little bit about the special considerations. So for consent, we ask for parental consent to join our youth advisory group, because when they begin, they're under the age of 18. We have to think now, we've got some people who've stayed on, they may be 19. We have to reconsider that. So we ask if parents would like to be copied on emails, and all of the parents actually responded that they did. So we do copy them on the emails. It's also a little bit selfish on our behalf, because kids don't really check email. So sometimes we think they make it a nudge from their parent. We also use Instagram, because they just don't go to email very often. For respecting privacy, we provide options for being acknowledged on products, and we explain clearly the implications of being identified, and we do ask for parental consent on that. We want to make sure that we don't invade anyone's privacy. Once it's up on the internet, it can be there for life, and maybe a decision you make when you're 12 or 13 years old, maybe when you're in your 20s, you think, oh, maybe I shouldn't have said that. So we take that really seriously. We don't want to deny anyone acknowledgement, but we have various ways of acknowledging people that don't include their full names, and we give them options for that. For vulnerability, that's very important to us. We never ask our youth to share personal healthcare experiences unless they wish to do so. So there's never an obligation to get personal. Some do, some don't. It's really up to them. For inclusivity, that's really important. We have several of our members use assistive devices such as wheelchairs. So we have to think, if all our meetings have been in person, but if we were to have travel, we would have to consider that. We have considerations for in-person meetings. If we never ask someone to turn their camera on, that's really up to them. Where we try to be as inclusive as possible with times and with different options. And finally, you know, we try to make it as youth-centered. We really listen to them. So although we may be asking sometimes for the same feedback that we're asking our parent advisory groups, we don't interact in the same way. So we spend much more time with them in virtual meetings as opposed to feedback by email or on shared documents, as some of our parents prefer. And we check in regularly to ensure that our format works for them, and we make those changes as we go along. So they've been really great at telling us what they like, what they don't like, and what works for them. So on to the next slide. So our engagement methods, so our meetings have all been virtual so far. We have youth from across Canada. That makes it challenging for time zones. So we usually end up at about 7 o'clock or 8 o'clock Eastern, so that the kids in BC can get home from school to join the meetings. We started with a youth facilitator who did a great job at the beginning and to get us started. But once we had like specific requests about our projects, we found that more difficult to integrate a person who wasn't part of that central theme to ask the questions, the probing questions that we were trying to get to improve our research. So we just kind of took over ourselves, facilitating the meetings, moderating the meetings. And actually we found out that our youth really like being close to the researchers and to the team who are doing the work, and they appreciate that direct contact. So we prepare meetings that are adapted materials. I'm going to give you some examples later that are adapted to 12 to 18-year-old, you know, explaining the feedback requests, and we circulate that ahead of time if they want. We weren't doing it at the beginning. Some want it circulated, some don't. So we always make it optional. There's never an obligation to read the material, you know, ahead of the meeting. And most of the feedback comes during the meetings, but either they can unmute or they can write in the chat. You know, we use Jamboard, we use all kinds of different techniques. But and most of our youth turn their cameras on. They're quite friendly with each other, but we always offer an opportunity to give further feedback if they thought about it afterwards. And that could be just a contact with our research coordinator, Allison, who has a really good relationship with them. And so we often get feedback that way too. So we have those options, and really our formats are informed by their recommendations and preferences. We've had a couple of evaluations where we talk to them, and I'll show you in a second what we, for accountability, these what we heard, what we did documents. And our compensation is $30 hourly. Our research coordinator tracks the hours for them and then asks them to confirm that this is right. And then she issues gift cards of their choice. We have several options for gift cards. So that seems to be working really well. They don't want to do the tracking themselves. So that seems to be working well. Next slide. So here's an example of a kind of a complex preparatory material. And this was for a PKU feasibility study, which is quite complicated. We're going to be asking young people, children and teenagers, to change the food that they're taking. They use medical food. And so we had this survey and we wanted to get their feedback. This was one of the things that they did on REDCap. So this is like the instructions. I know it still looks like a lot, but it was quite complicated. We didn't realize that they would think that we wanted them to fill out the survey. So that was very interesting. The first couple of things we did, there were a lot of surveys involved, and they would fill it out. And finally, one of them said, well, you know, no one's ever asked us to edit a survey. They just give us surveys and we do them. So that's why we filled it out. We didn't think you wanted our opinion on what the survey looked like. So we had to make that clear. Next slide. Here's another example. And this is, they got very involved in our registries. We launched 2 registries just a couple of months ago. And we had to explain, you know, what a registry was. So we provided this sheet and then what their role was and what they would be doing in the registry. So we try to prepare some materials like that. We have slides for the presentations, and that seems to be working well. Next slide. And then when we're in the middle of a project, this is an example on the core outcome sets, and we always remind them of what they've done, and you see the hand up, they participated in that part, and this is where we're going. So this would be like they already know the process, they already know about core outcome sets, but now we're coming onto the Delphi survey, so we remind them of what they had done before, and that seems to work well too. Last example is an example of what we heard, what we did document. So this was about the video that was going to go on the registry page and the promotional materials. So that was quite interesting. And here you see in the what we did, we actually did everything. Sometimes we don't. And if we don't, we explain why. And that's kind of a really good training for them, because then they understand research, they understand what our restrictions are, what's allowed, what's not allowed. So we produce that for every engagement that we do. Every time we ask them something, we come back and we say what we were able to do with it. So that was quite interesting. So I'm going to go on to the next slide, and we're gonna play two short videos. So this is kind of the engagement highlights. The first one is from year 1. The second one's from year 3. I actually made them myself on Canva. You'll see in year 3, I'm getting a little bit better at it. Instead of sending out a newsletter with a bunch of things that they did, I stripped all the names, but our personal one had their names on it. So I stripped all of their names, and I think the first one's about 1.5 minutes, and the second one about the same length. So this will show you a little bit of what they actually did. So play the video, please. That was at the 6-month mark, so not as much. And the second one, this is from 2023, December 2023, so this is more recent. Thank you. Next slide. So I'm just showing you an example of the clinical trial infographic. That's all on our website. At the end, I'll show you where the resources are. It's available in French and English. The reason I'm showing this project, this really was a co-production project with our youth. And we know that they were invested because near the end, one of them wrote to Allison and said, "Is that the final version? Because I want to print this and put it up in my bedroom." So that was our sign that we had that they had really invested themselves in this project. So, and the next slide is just an example to go with that. We then made a video that, based on what they said there, that they also went through and edited. And so there's a video in English and French that accompanies the infographic. So off to the next slide. I'm almost done here. So for the impacts, we've got the PKU feasibility study, very important to ask people to enter a clinical trial where food is involved, medical food. We just showed you the infographic. They attended, two of them attended the MPS Core Outcome Consensus meeting. It was a huge accomplishment. They looked at a lot of questionnaires for the registries, which questionnaires they would want to fill out, how often would they want to fill them out. There was an activity log. So the SMA is a video game intervention. They looked at the activity logs the kids would have to do, and participated in making a trial video. And for the Humira trial, they really looking at the design and consent forms, and we have that youth co-investigator. And very quickly, next slide, we also have an youth engagement evaluation. We're running parallel to our adult evaluation. They ran it completely differently. They told us exactly what to do. They told us what the goal should be and how to do it. We had a 100% response rate to the surveys and 80% response rate to the focus group or interview. And we found out that the surveys work really well for improving how we engage, and the logistics, and really the focus groups is where we were able to measure the impact. Next slide, I picked 3 things that they said about transferring information, about being with other kids with similar disabilities, and also the first one, which is just if you have teenagers, this is how they talk, right? So how about asking us stuff in areas that they don't think they needed an improvement in? So I thought that was really interesting. And just our lessons learned are really about start slowly. So, next slide. Sorry about that. Start slowly and build your engagement relationships. Adopt that continuous learning approach. Be thoughtful. Take time to discuss and think about what you're proposing. Take time to listen to them. Provide training and guidance. Everyone's interested in long-term impacts. Make sure you communicate them, and think about reciprocity, like offer them opportunities to connect with networks and projects. So I'm going to end with a video. I'm just going to get it in. So this is one of our youth, and this was for another project called Impact, for a course. And we just gave her, she volunteered to do this. We put the call out to our youth. We had no idea she was even going to talk about Inform Rare. So it was a bit of a surprise to us. So let's play the video.
I know what I'm talking about, they always say. What they really mean is, you don't know what you're talking about. Even when I'm talking about my own life. As a teen with spinal muscular atrophy, my opinion about what is best for me is rarely taken into account by others, whether it's doctors or people I meet on the street. That has been the truth for as long as I can remember. I've always wanted to be like the other kids. I wanted to follow them around town and go to their birthday parties. But it wasn't always possible because it wasn't accessible. So I was left out. Eventually, my perspective changed. I was going to be the person that I wanted to see in the world when I was younger. I wanted to change the rules, to be an inspiration, to be someone the next generation would look up to. And then I learned about InformRare, an organization working to improve healthcare for children with rare genetic diseases. I know it can sound a little like, and then the dragons arrived. But InformRare really did have a huge impact on my life. For the first time in a healthcare setting, my opinion mattered. I am a part of their youth advisory group, along with other youth across Canada, with SMA, PKU, and EPS. We meet and discuss things like patient questionnaires and research studies. We talk about how we would change the questions to make them more clear. We create materials like posters to share with other youth about how to participate in research. We also give feedback on projects in development, like video games and media. Our opinion matters. There's never a wrong answer with InformRare. What I love about them most is they value youth. They helped me find my voice. I feel heard. I leave each meeting knowing I have made a difference by helping to create something better. It kind of makes me think of a quote from my favorite TV show. Being part of something special makes you special. And I know what I'm talking about.
Hey, so fthe is 13 years old. She wrote the text entirely herself and chose all those images. So when I'm having a bad day, I just kind of play that and encourages me to continue with youth engagement. Okay, last slide. So this is our network with our principal investigators and our network members from across Canada. Next page, I put some resources here for you. And they're all on our website, so informrare.ca. And I'd love to hear from you about your engagement journey. And finally, a thank you to our exceptional youth advisors, our special advisors, a little bit older than a youth advisor, and our patient engagement co-leads. Thank you for your attention.
Thank you so much, Maureen. We have time for 1 or 2 questions for Maureen, so you can feel free to ask any questions you may have using the chat box, or you can raise your hand or send your question directly to the CDTRP Q&A. So I'm just going to pause to see if we have any questions in the chat or if anyone has their hand up. Yes, Sherry, you can go ahead.
Hi, Maureen. Just such an amazing job. I think what you're doing is with the youth is so important. As a caregiver, I always consider the limitations and barriers that I potentially could bring forth in research that may not capture the youth voice. So I think it's so important to get the information directly from the source. And research shows that there is a bit of a disconnect and discrepancy between caregivers and children. So I think that that's incredibly important. I'm looking at a project that is or an organization that is starting to bring on youth, and they're the older than the group that you suggested, which is interesting. And the reason is because, again, as the session before which I asked the question about trauma-informed research. And so there is that, kind of question of how do we manage trauma that could result out of a research project when we invite youth into it, and what is being done to mitigate those things. As we look at adults being involved in the trauma-informed road and ensuring that we're not causing more harm. I guess the idea is that how do we do this with kids when we don't have a clear road with adults? And maybe you have come up with a plan and some insight in regards to this, whether it's the projects you choose or the support that you give. But I would love to hear how you have been able to look at this and maybe problem solve and have some ideas on how to manage that.
So one of the approaches that I didn't say that we use, Sherry, is that we kind of play the mama bear, papa bear role. So if we don't let people into our close circle. So if they want to engage with us, like the University of Toronto students, we provided a lot of training for them. They had to take certain courses, they had to meet with us. Then we were at all the meetings. It's all very controlled because we worry about about that, because we've done some training, we know them, and so that you have to be really careful. We don't like farm them out, like we're very careful to keep that trust going. But I don't think you can ever completely eliminate it. But is that a reason for not doing it? Like, you have to try to mitigate it as best you can. And there's lots of good resources out there now, but it's still not maybe for the younger youth, I think for older. So I think that's a gap too. So that's a really good question. Thank you. If somebody asked about compensation, do we think it'd be as good without compensation? I can tell you that in the PKU patient partners, we have done everything to get those kids engaged, and we have a very difficult time. And we offer the same compensation as we do with the other groups, and they're very aware of it. And yet we still have a really hard time getting those youth engaged. So I would think that, I don't know, maybe for some it's important, but I think that we offer it and we still don't get like some of the people that we think might want to join. So, because $30 an hour for youth is a pretty good wage. So, but it's yeah, for them, I think for a lot of youth, it's a matter of time too, especially in our area where they have severe diseases where they're trying to get through school often.
Thank you.
We have time for one more question from Caroline.
Yeah, hi, Maureen. Thank you very much, and I apologize. I was a little late joining, so I may have missed this. But I work with Indigenous populations, right? So as a Métis researcher, and we're very aware of the vulnerabilities of our youth, and particularly when they're experiencing severe illness, right, and challenges like that. So in the context of the work that you're doing, are there Indigenous youth, and what is the relationship of the work to the larger Indigenous community, whether that's First Nations, Métis, or Inuit, and how, or is there any certain supports, extra supports, or cultural supports that are provided to, or is Indigenous identity just not something that comes up in the work that you're doing?
So in our youth advisory group, we have not had any Indigenous youth sign up. That's probably our fault that we haven't done, targeted recruitment and made it. So I think that's an area where we need to grow, and we're open to that. I just finished doing a 10-hour cultural safety course. We're a bit nervous about it. We want to do it right. We try to do everything right. So we're very thoughtful. And I think that at the point that we're at now, we need to be, further exploring. We've had some conversations, but we haven't done anything concrete yet. But and I think that that's really on us. It's not on anyone else, but really on us to reach out more and to work with those communities. And so thank you for the question.
Yeah, and I'll just add that none of us should think that that's easy to do, right? And so, so the idea that if you just reach out, that there's an easy pathway. There's a lot of historical reasons why Indigenous and contemporary reasons why Indigenous people are suspect, particularly when it comes to children and youth around research, right? Or around interventions that, so I would add, not to be too hard on yourself, that, this is something that is not easy, and it takes a long time, and it takes resources, right? So yeah, thank you.
Thank you.
Okay. So thank you once again, Maureen, for your fantastic presentation, and to everyone for the discussion. I'm now going to introduce our next.
Excuse me.
Oh, sorry.
I have a question, but I don't know how to raise my hand. I'm
you
Marina. I don't know how to raise my hand. Sorry to interrupt you.
That's all right. You can go ahead and ask your question in that case.
My question is in reference to Indigenous engagement, like for youth, and as the other speaker just mentioned. So what is the path forward? Is there a need for Indigenous engagement? And if there is a need, how is that need being addressed?
Well, I would definitely say there's a need, but it has to be addressed in the way that Indigenous youth want to be engaged and not how we think they want to be engaged. So there has to be discussions and conversations that go on to actually, do that Indigenous engagement, and we're just not there. We just haven't got there yet. I'm it's too bad. It's unfortunate that we haven't got there, but that's kind of where we are. But absolutely not because we don't think that it's a need. We think it is a need, but we want to do it in a thoughtful way, and that means engaging more with the communities and figuring out how we're actually going to do it. So, yeah.
Well, I just want to mention that as a patient partner, and I have a lived experience, and you say that Indigenous youth need to ask. Well, when you're living with a disease, you don't know what questions to ask.
Right.
You
So
know,
I
and
don't
how
know
do
if I
you,
said they need to ask. I said we need to find them. I don't think it's on them to find us. I
oh,
think
okay.
we need to go to them. It has to be, but we need to go through them through the right channels. Is it through their communities? Is it through the people that they trust? Is it through, in-person meetings that we meet them? But absolutely, all of the youth don't, we find them basically rather than they find us, I think.
Thank you.
Thank you, Maureen. And again, thank you for the discussion as well. Now.